What is actually Botox? Botox is actually a trade name. What actually the active component is botulinum toxin. So botulinum toxin is something which is naturally occurring in the nature. It is produced by a bacteria called Clostridium botulinum. It's basically a neurotoxin. The function of this neurotoxin is to relax the muscles and paralyze those muscles. The effect of which is very temporary in nature, and once the action goes away, the muscle will function completely to its normal state. So usually this botulinum toxin in for cosmetic purposes, we call it Botox cosmetic, is used for indications with facial aging, and it's one of the most sought out treatment for as non-surgical options for facial rejuvenation. So Botox injection usually is given for wrinkles in the face. Most commonly these forehead lines which I'm making now, or these 11 lines which you can see, or we call them frown line, while we do frowning and all, lines which we see on the eyebrows and in between your eyebrows. And other thing is the crow's feet. Once we close them, the lines which appear on the side of your angle of your eye, we call them crow's feet. For these wrinkles, for the prevention, and we give these Botox injections. So Botox injection has to be given, it has to be taken periodically, annually or every annually. Botox effect lasts for say 6 to 9 months or so. Once the effect goes away, you need to get a repeat Botox then. Ideally, to start with, Botox injections has to be started once one crosses their 30th birthday or 35th birthday, or someone whom is prematurely aging. For certain indications, we might even start Botox even early also. Non-cosmetic indications like hyperhidrosis, that is like excessive sweating of your underarms, or for severe migraine headaches or some other blepharospasms also, Botox injections are given on face for certain other reasons even. So usually in any adult who is over 18 with their proper consent, we give these Botox injections, which we tell them that these Botox injections, the action of this Botox is temporary and needs to be repeated once this effect is done. So Botox injections work when these wrinkles are about to develop. Once these wrinkles have developed, say in a 65-year-old or a 70-year-old person, once the wrinkles have become static, see, normally anyone can make these lines during normal talking or while they're giving any kind of facial expressions. So we have plenty of muscles in and around the face with which we give all kinds of facial expressions. When properly done, Botox injections are safe when you are in good hands of an injector. So if the injector is inexperienced, or because of some reason if the injection is given in a wrong plane, we can have problems with even Botox also. The most commonly seen problem with Botox, if it is not properly done, is an underdone Botox or an overdone Botox, and Botox which is not done equally on both sides. We can have problems with facial expressions, or the levels of your eyebrows or something. One may become higher or one may become at a lower level or something, which is seen if the injector is not properly trained.